They are the first cases to be reported in the county in 6 days. And joining us once again, Dr. Jim Shames, Medical Director for Jackson County. Thanks very much for being with us.
My pleasure.
So what can you tell us about these specifically 6 cases, the 5 connected to Harry and David so far?
Well, we had 1 case last week, and then just yesterday we identified additional cases. Once you get over 3 cases, certainly 5, that's considered an outbreak. So Harry and David's been great to work with. They were on top of this as soon as they found out. They've sent all the people within this one section of their factory home. They've done some extensive cleaning. They've had a number of meetings with us at Public Health. We've been able to arrange for testing for all the individuals that may have possibly been in touch with these cases. That would be 50 or 60 tests. And so we're waiting now for the testing to come back and see where we are. So we're at a we don't know stage right now.
Given that you know those folks are infected and given the gestational period, when do you think you'll know what number or percentage of those 50 or 60 are positive?
Well, that has to do with how quickly the testing can get turned around. We're hoping we can get some results tomorrow. And if not tomorrow, within the next day or 2. They were couriered up to the state lab. The state lab's going to address them as soon as they get them. So we'll know a lot more in the next 48 hours.
So I'm assuming you then contact trace those folks. How did that process work, and what have you learned about how well or how the program can be improved if it needs to be?
Well, we're contact tracing the individuals we know to be positive, finding out who they've had contact with, asking those individuals to quarantine themselves until we get more information. And in a place like this, it depends on sort of where they were in the workplace, whether they had any contact during their break, or who they might socialize with. We're still figuring that out. But I'm hoping that because Harry and David's tried hard throughout all this to minimize the potential for infection, and the fact that we've gotten on it quickly, we've got lab work coming back very shortly, that I'm hoping we can get a handle on this and that it won't get out of hand.
Real quickly, I think I know the answer to this question, but just to verify, how concerned, if at all, should someone be if they recently purchased a product from Harry and David? Not
at all. This is a respiratory virus spread from person to person. The virus, if it lands on an object, it doesn't survive very long, and it certainly is not going to survive very long on a food object.
Dr. Jim Shames, Jackson County Public Health, we appreciate your time as always. Thank you very much.